The eyes are the main adornment of the human face. Through them, we make visual contacts, keep in touch with the outside world, and express our sympathy and love. And if disaster happens to the eyes, this is a real tragedy for a person. In Russia, there are approximately 640,000 people who, due to injury, various diseases or birth defects, have lost one of their organs of sight. About 7% of them are children. The only way for these people to return to a normal life is through eye prosthesis.
Первые протезы были сделаны в Венеции в средние века.
The first prosthetic devices were made in Venice in the Middle Ages. Then France made leading prosthetics out of glass. And finally, the most highly developed glass eye prosthetic devices were made in Germany. Germany still makes glass prosthetic devices. Until World War II, it supplied glass prosthetics around the world. During the war, the need for eye prostheses, of course, increased greatly, but the Germans were not supplying the prosthetics abroad. Therefore, the need to create eye prostheses in Russia appeared. The Moscow Center of Eye Prosthetics is the oldest establishment in Russia with this unique profile. Its history began in June 1943, when the Moscow Factory of Eye Prosthetics was established by order of the Council of People's Commissars, becoming the forefather of this industry in the Soviet Union. Throughout the existence of our company, many new forms of individual prosthetic devices have been developed. And we have a very large range. It's in our armory. We take them out and select them for each individual. This form enables a person to immediately check the wearing of these prostheses. Then the color will be amended individually for each person and the prostheses individually manufactured. The forms are highly diverse and fill the space of the non-existent, removed eye. The number of patients seeking help at the center is huge. On average, specialists see about 40 people a day. We believe that it's best and least traumatic to select ready-made forms which fit the conjunctive cavity. We give this form to the patient to try, for example, for a day. If the person finds this form comfortable enough, then we modify it slightly. That is, we smooth the edges, add volume, or increase the plug. After that, we look at tolerance. If the patient has no hyperemia of the conjunctive cavity, no mucus discharge, and no pain, we use this form for production. Generally, our patients are very satisfied with their appearance and comfort of wearing an eye prosthesis. Patients come here from all over Russia because after 7 decades, the center is still the leading organization in the country for an eye prosthesis. For residents of other regions, a mini hotel has opened in the center with comfortable rooms and prices significantly lower than average in Moscow. There are a lot of children who come to our center for prosthetics. There are children with congenital disorders. They have completely undeveloped eye cavities and so require faced prostheses. This is implemented as the child grows. This takes place from age 3 months. The prosthetics are placed in larger sizes of specified form, single or double-walled, or there are prosthetics to form fornices. At our center, forms have been developed to create the anterior and posterior fornices with a type of pin that holds the prosthesis in place. As many of the patients at the center are children, a nursery has been opened for them, where they can play and watch cartoons while waiting for their appointment. There is a cafe and other facilities for patients on the premises. Prosthesis begins with an examination of the patient by a physician at the medical department of the center. The doctor inspects the eye cavity, determines its suitability for prosthesis, provides recommendations for selecting the materials for manufacture of the prosthetic device and for care for it and the eye cavity. Recently, our surgeons have started to make progress in forming the locomotor stump, which has improved the cosmetic effect. In such cases, the forms are thin and small. Previously, when people could not do this and the clinics did not form the stump, simple inoculations were performed, where the forms were of course large and heavy, with all kinds of individual characteristics. And here we have developed all these forms. Many people come to us for their prosthetics all their lives, from start to finish, from 3 months of age and the whole time they can walk. They come to us in order individual prostheses. After examination by a doctor, the patient is referred to the head of the workshop, who invites the master prosthetist to determine the color of the iris for the prosthesis. The finished prosthesis is tested in the presence of the patient by the doctor for consistency in form and color of the iris, and by the head of the workshop for quality. At the request of the patient, several prosthetic devices can be made. For example, this includes people living in remote areas, athletes, or individuals whose occupations are associated with the risk of damage to the eye prosthesis. We need at least 10,000 prostheses to meet the needs of our patients. When the Moscow Center of Eye Prosthetics started working back in 1943, it produced eye prostheses of milled glass, colored glass, and colorless glass. Glass is still one of the most practical and user-friendly materials with excellent cosmetic properties. At the center, prostheses are made with several kinds of glass: scleral, corneal, background, and pupillary color, each of which has its own patented recipe. The prosthesis is light, well moistened with tears, and has a very smooth surface thanks to hot kiln polishing.
Стекло, которое мы сейчас используем, это полностью наша рецептура.
The glass which we now use is completely our own recipe. It differs from German glass because it uses fundamentally different production technology. European prosthetists, particularly in Germany, still work with a very small number of patients. 40 or 50 people see us per day. The masters are highly skilled glass blowers and produce a glass prosthesis in 2 or 3 hours.
Срок использования стеклянных протезов.
The terms of use of a glass prosthesis is about a year. However, it depends on the subjunctive factors and on the condition of the eye cavity. Some people can wear 1 or 2 or 3 years. Some people have an aggressive environment in the cavity which wears the prosthetic device in just 6 or 8 months. In this respect, plastic prostheses are more practical. Plastic prostheses are highly durable. The term of use is 2 years, which is double that of glass prostheses. Plastic prostheses are safe, they hardly cause any damage to the environment, and they can be restored and even change form slightly to reflect the shape of the eye cavity. This further increases the service life of the prosthesis. Russia is the only country in the world to use a microwave oven in the manufacture of plastic prostheses. The percentage of residual monomer, which is a poison, is significantly reduced when using this method, by several dozen times. The time required to manufacture plastic prostheses is from 8 to 10 hours. In its many years of work, the Moscow Center of Eye Prosthetics has helped tens of thousands of people to return to normal lives. The center constantly commissions research institutes to develop new polymer materials to improve production. The center produces eye prostheses for healthcare organizations in bulk. They are used for selection by patients in regional eye disease institutes, eye prosthesis surgeries, and hospitals. The quality of these implants is no different from the individual ones, and the price is much lower. At the Moscow Center of Eye Prosthetics, it is also possible to undergo consultations and treatment of various pathologies of vision, select glasses and contact lens correction, and choose contact lenses from leading manufacturers, as well as glasses and frames. Consultations are carried out by ophthalmologists of the highest category and candidates of medical science.